evening, everybody. This is week 3, the Recording for Quality Management Challenges, the clinical versus administrative perspectives. First, I'd like to just review the history of lean principles. We talked last week, I believe, about the Toyota production system, known as the TPS, which is based on one of our theorists that we've been studying, Deming's work. And it focuses on the production process and building quality in the process. Lean thinking is a management strategy which has to do with improving these processes in any organization or industry. And organizations are composed of a series of complex processes to create value for the customer. So when you look at improving processes, that's similar to what we've been reading about in the aviation industry, which has been improving their processes to assure safety for anyone who flies with the airline. And later on in the course, we're going to be looking at the use of checklists to try to assure a higher level of safety in both the aviation industry and also in the healthcare organization. Basically, when we talk about the term lean, it means that using less to do more is the strategy that's being implemented. Also, when we talk about lean, we talk about eliminating muda. The core idea of lean strategies involves determining the value of any given process by distinguishing value-added steps and eliminating muda, which means waste in Japanese, so that ultimately every step adds value to the process. So when we look at the step-by-step process of a patient going through being admitted and then getting care in several departments and then discharge planning and being discharged, and even the post-operative experience or post-admitting experience, then we realize that there may be hundreds of steps in the process to move a patient along the care continuum in a very complex organization, such as a hospital or an ambulatory care center. And as we've mentioned before, this looking at the detail of a process is even appropriate in other industries. And we've talked about looking at McDonald's and the process for putting together a Big Mac hamburger, and the fact that McDonald's has to make sure, in order for them to be successful and to be profitable in their industry, they need to make sure that they've eliminated any of the wasteful steps, the overutilization of people, the overutilization of products and supplies, to assure that that Big Mac, when it reaches the customer, is consistent in the quality, is timely in the delivery, it arrives hot and well put together. All of those things go into looking at a lean strategy for process improvement. So when we look at the application of this strategy to the healthcare industry, we know that to maximize value and eliminate waste, the leaders in the industry must be able to evaluate processes by determining the value desired by the user. And over these past few years, when we've been focusing on quality improvement and lean strategies, it's become very clear that the patient is the desired user of our product, which is patient care. Also, the leaders must identify every step in the process, and this is called a value stream. So you look at not only every step that occurs in the process of patient care and or putting together that Big Mac hamburger, and you look at what the value is in each step. And if it's not a valuable step, then it's considered wasteful to the process. And therefore, you want to eliminate those non-value added steps. You want to eliminate the waste. and make value flow from beginning to end based upon the pull, which is, in our industry, the express needs of the patient. In other industries, it might be the needs of the buyer or the consumer. The power of lean in healthcare means that lean thinking begins with driving out waste. All work adds value and serves the patient. And this is mandatory. All work must serve the patient. We must create an organizational culture receptive to lean thinking. And as we've read in many different documents and in our textbook, this concept of lean thinking and changing an organizational culture has to start at the top. But it also has to involve all staff to help redesign processes to improve flow and reduce waste. To change a culture by involving staff in the change process, we have to look at how we can do that. And one example from our readings is the Virginia Mason Medical Center up in Seattle, Washington. We see that Virginia Mason is a nonprofit organization offering integrated health services, including a multi-specialty group practice of more than 440 physicians, offering both primary and specialized care, including a network of clinics throughout the region. VM also includes an acute care hospital license for 336 beds, so it's a good size hospital. It includes the Benaroya Research Institute at Virginia Mason, known as the BRI, which is an international leader in autoimmune disease research. And then last, it includes the Bailey Boucher House, a nationally recognized facility for people with HIV/AIDS and other life-threatening illnesses. In addition, Virginia Mason Institute also includes also is the nonprofit education and training organization teaching the Virginia Mason production system called VMPS, which is modeled after the TPS, the Toyota production system that we learned about in week 1 and 2. This VMPS is their management methodology that's being implemented in order to change the culture since 2002 when this strategy was implemented. So let's look at some of the principles of lean at Virginia Mason. First of all, which is very impressive, is their no layoff policy. At Virginia Mason, they believe that they're able to redeploy employees as they start improving processes and eliminating wasteful steps. Then there may be employees that are no longer needed in that continuum of care. But instead of laying off these people, they have determined that they can redeploy them to other areas within the organization. Also, they don't fill their open positions until they've determined what the lean strategy is for that department or that patient care unit, so that they're able to take these employees that may not be needed in one area of the hospital, do retraining and organizational retraining, and put them then into an open position, maybe in another area. And then they also are focused on eliminating waste. They also encourage all employees to attend Introduction to Lean course, which they offer frequently throughout the year to both new employees and ongoing employees, so that everyone in the organization understands the importance of the lean strategy at Virginia Mason. Also, employees participate in RPIW, which is Rapid Process Improvement Weeks. These are week-long sessions where teams analyze processes and propose, test, and implement improvement. Some of the results of the RPIWs that were illustrated in the article that we read are things like inventory, which was down 53% and measured in dollars, so that they saved 53% from 2002 to 2004 in the amount of inventory that they were holding. They increased their productivity, which was measured by the number of FTEs And instead of laying off employees, that they were able to have 36% redeploy to other open positions, which isn't a cost savings in itself because it costs more to recruit and orient a new employee into a position than it does to take an older employee or one that's worked at the institution and then redeploy them to another area. They also looked at floor space, which was down 41%. So instead of building new buildings and opening up new centers, they were able to increase their efficiency in some of their processes and find out that they didn't have to buy new space. They also measured things like lead time, people distance, how many feet people had to travel in order to get a process completed, product distance, which means the um, movement of a supply from central supply to the unit to the patient, those types of things. And they were able to decrease that by 72%. And then also things like setup time, which was down by 82%. So these are some very dramatic results that Virginia Mason had experienced in just a 2-year period of time. They started implementing the lean strategy in 2002, and the results were first reported in 2004. At Virginia Mason, the production system has 6 areas of focus. As we've already mentioned, they've identified that the patient first as the driver of all processes. In other words, everything is patient-centered, patient-focused, and all the staff believe that they work for the patient instead of for a certain department in the hospital. They established an environment where people feel safe and free to engage in improvement. This includes a company-wide defect alert system called the Patient Safety Alert System, where any staff member has the ability to stop the process so mistakes aren't embedded in the system. And the illustration of this was very similar. I think you read that several of the VM employees traveled to Japan, not once, but several times over the years, to watch the Toyota production system and the manufacturing system in real time. And what they saw is that anybody along that continuum of manufacturing can stop the line by just pulling a cord that alerts management that they found a defect. And by doing this, then that defect is corrected before it just continues down the manufacturing line and ends up being something that then is embedded in the system forevermore, and the cars actually get out into the sales force, they're sold to the consumers, and that's when you have problems. So it's the same in healthcare, that Virginia Mason has now developed an environment where anybody can basically pull the cord and alert management that there's a safety patient issue. There's also encouragement of innovation and try-storming. We've heard about brainstorming, but this is trying something new, being able to implement new ideas and just have pilot programs where they can try something to see if it works. They've also managed to create a prosperous economic organization by eliminating waste in many of their processes and systems. And they're very proud of their accountable leadership. So at Virginia Mason, it really does start at the top. They also did a comparison of a traditional healthcare environment versus a lean healthcare culture. You can see on this slide that in a traditional culture, you have things like function silos. And in a traditional acute care hospital, these are the departments. You have the Department of Radiology, the Department of Surgery, the Department of Nursing, the Department of Dietary Management, and on and on and on. Whereas in a lean culture, they look at more of a horizontal system and look at pulling people together on interdisciplinary teams in order to care for the patient and manage the quality of the care. Another aspect of a traditional cultures is that managers are the directors of the activities in any one area. And in a lean cultures, the role of the manager changes drastically. Instead of being a bureaucrat and an autocrat, managers are expected to teach and enable people to do the job the best way that they can and to participate in the lean culture. Traditional culture also has a tendency to blame people, to point fingers at, this is why there was a medication error. It's the pharmacy's fault. This is why the patient wasn't discharged in time. It's the discharge planner's fault. Whereas in a lean culture, these interdisciplinary teams work very hard to look at analyzing the root cause of any problems or errors. So instead of just pointing the finger at one person or one department, a multidisciplinary team gets together and uses a process to look at the root cause of a problem. Another aspect of a traditional culture is that rewards tend to be individual rewards. And in a lean culture, it's group sharing and group recognition. In a traditional hospital culture, the supplier is always the enemy. It's always easy to blame the vendor or the people who supply the equipment. And instead, in a lean culture, the supplier becomes part of that interdisciplinary team. If there's a problem with a piece of equipment or a supply that's being used, then in a lean culture, it's not unusual to have the vendor rep sit on that team and talk about how they can improve, how their company can improve, or listen to some of the issues that the clinical people or the admin people have about equipment and supplies. In a lean culture, it's also very important to share information, both horizontally and vertically throughout the organization. In a traditional culture, we always talked about if we just could have more patients, then our costs would be lowered. So patient census was always the key to the day. In a lean culture, though, instead of the number of patients, they're looking at making it more efficient for each patient that's being provided care, so that removing the waste in the care continuum is what's going to lower the cost to both the hospital and to the consumer. And there again, in a lean culture, it's very customer focused and very process driven, all of which we've talked about when we talked about our total quality theorist and how those are implemented in different hospital systems. So some of the key concepts in lean thinking are that of leadership. It's a whole system strategy, not just one person. The CEO must be a champion of lean management and create an environment conducive to change and experimentation. And so you might see or have seen over the course of the last 10 or 12 years a lot of transitions in these CEO and COO positions. And some of that is because when the hospital and the board of directors decide to embark upon a total quality management philosophy, whether it's the lean thinking philosophy or one of the other TQM strategies, oftentimes the CEO who might have been there for many years is seen as someone who may not be able to change or change so drastically in order to bring on a whole new culture and implement that throughout the hospital or the environment. And so a second concept is that of culture. It's a set of values and beliefs, and oftentimes those values and beliefs need to be tweaked a little bit when you start doing a lean thinking model. The challenge is that it requires people to change how they do business. They have to change how they provide care to patients. And they're invested in these processes. So sometimes the resistance is that the care providers realize that if they change the processes and eliminate the waste in the care continuum, then they may be in fact eliminating their own job. And this can be very threatening and very frightening to people. So that's why the CEO and leadership have to develop a culture that people understand that they won't lose their job. They may be retrained to do their job differently or to do their job in a different area of the environment, but in fact, they're not going to get fired. And that's very important because that is can be very threatening to people, and it affects their lifestyle and their well-being. And then the third concept is that of process. We've talked a lot about process. and the importance of looking at the value stream of a process. And within that process, a lean thinking environment must identify the primary customer as the patient. In retail or other industries, the primary customer may be the consumer or the purchaser of a new car or the purchaser of that Big Mac. So in any industry, in order to look at process improvement, you have to know who you're improving the process for. And in healthcare, that is the patient. In a perfect process, every step is valuable, capable, available, flexible, and linked by continuous flow. So if you think of all of those things when you think of any process that you do in your work environment, just take a moment and look at one process from beginning to end and look at whether every step in that process is valuable, capable, available, flexible, and linked by continuous flow. Because then you'll be able to start seeing where some of the breakdowns in a process might occur. One way that we read about to change or to look at changing a process is through the use of teams. And one of these teams is called a Kaizen team. Kaizen event is a 4-day session focused on analyzing current processes and implementing changes. So Kaizen means change and looking at change in processes. It always involves those team members directly involved in the process. This is a huge change in the healthcare environment because when you look at a traditional culture in an acute care setting, it's divided vertically in all of these silos, all of these different departments. And oftentimes when a problem occurs, one department will get together and try to solve that problem and sometimes end up pointing their finger or blaming another department. So if there's a medication error up on a nursing unit, that nursing unit might get together, the manager and a night shift nurse and a day shift nurse or whatever, and look at the process of delivering medications and how that error might have occurred. But in a lean thinking model, instead of just doing that one department looking at that problem, the nurse manager would then start to put together a Kaizen team of everybody within that continuum of medication delivery, starting with the vendor, going to the pharmacy and which products the pharmacy buys, looking at the process in the pharmacy of distributing medications and whether it's a unit dose system or a general hospital or a full unit system, looking at that process and determining where are the waste steps and if everything is of value to the patient in that process. Then the nurses get involved in looking at what their process is. How do they take out the medication? How do they divide it up into the patient dose? How do they take it from the med room out to the patient room? How do they check that it's the right patient with the right medication at the right time? So all of those steps. And then how do they assure that the patient has taken the med successfully and has positive outcomes from the effects of that medication? So a medication error in itself is a whole team of people throughout the hospital, both vertically and horizontally, when you look at a process that seems somewhat simple of providing a medication to a patient. And then part of what the outcome of this team is that they develop a map of the process as it actually happens, step by step, and this is called the value stream map, where each one of those steps, once it's documented, is then looked at for those criteria that we discussed earlier. Is it valuable to the patient? Is it wasteful to the process? And what is the final outcome? Then next, the team envisions and maps the future state. So how would they like it to be? What is the perfect state of existence for that process? What would make it the best of the best from everybody's point of view? And how to move that process towards perfection. And then after that, Then we implement and sustain the new process through PDCA, which is plan, do, study, and act. So we plan how to implement the new process. We do it, we practice it. Then we study, are we doing it correctly? Are we doing it as it intended? We do another value map maybe, or a value stream map. Then we act upon the data that we collect from that. So total quality management is a continuous flow. It's not just a linear process that starts and ends. You constantly put it through the PDCA process over and over and over again. Another one of the examples from our reading of someone who's implemented the lean thinking is Theta Care Incorporated. And Theta Care has, similar to the Kaizen model, event weeks, which focus on their concepts are respect for people, teaching through experience, and focusing on world-class performance. So those are the three values that they have embedded into their improvement system. The goals of their improvement system are improved staff morale, improved quality, which to them is being measured by the reduction of defects, and improved productivity. So some of the results that Theta Care has achieved that was measured in 2004 is they've had a $3.3 million in savings. They've saved $154,000 in the cath lab procurement process. So they looked at inventory and reducing waste in the cath lab. They've reduced accounts receivable from 56 to 44 days, which has increased their cash flow by $12 million. They've been able to redeploy staff, which has saved 33 FTEs needing to be hired and trained. They've improved physician phone triage times and abandonment rates. In other words, people hanging up on the phone after sitting there for so long. They've reduced by 50% the time for admission paperwork. So they've looked at the process of admitting a patient and identified that there was a lot of waste in that process, too much paper being handled, and they reduced the amount of paperwork by 50%. And as you read in the article, there were several other things that Theta Care had some positive outcomes. So let's look at the pros and cons of system-wide TQM implementation from, number one, a clinical perspective. The pros is that increases patient satisfaction. The cons, however, as we've talked about before, in any implementation where you have to change a culture, you have to do organizational learning, you have to change individuals' behaviors, you have to change processes, there may be a long-term wait for results of this implementation. Another one of the pros that we've seen is that a lot of the institutions are adopting a no layoff policy. One of the cons is that there is a deployment of staff. In other words, people are moved from where they've always worked to maybe a new place to work and into a new role. The commitment with that is that there's organizational learning and individual learning, but oftentimes that's still a lot of change for individuals, and some people just can't handle it. Another of the pros is that you bring together multidisciplinary teams to be involved in changing the processes and improving the processes. However, one of the biggest cons is that this is very time consuming and becomes expensive because you're taking staff away from patient care. And when you do that, you have to replace those staff in order to provide patient care. So it almost sometimes is a double whammy as far as salary costs. Another pros from the clinical perspective is that it is outcome oriented. The nurses and the patient care providers can see positive outcomes with their patients and with the care continuum. However, one of the cons, as I mentioned, is that it can be very expensive. And so the hospitals that are implementing new total quality management programs and lean thinking strategies are finding that there has to be a long-term commitment and there has to be money dedicated to keep the system sustainable. From an administrative perspective, one of the pros is that you do see a return on the investment, but it takes a long time, and that's one of the cons. This is a very long-term strategy. As you can see, places like Virginia Mason and Theta Care started working on this strategy 12, 13 years ago now, and they're just starting to see some very positive, measurable results. Another of the pros from an administrative perspective is that it's very consumer focused, is that we have identified that the patient is the consumer and that we all work for the patient, whether in an acute care setting or whether in an outside industry, in ambulatory care, in a nursing home. It's always the patient that is the center of our focus for our care delivery. And it's the same outside in industry. I think you can go to any retail organization or manufacturing industry and they're going to say it's the consumer that's the focus. The con is that you may get patient complaints because the patients are also involved in this change process. They're also involved in the change of culture in an organization. So if they've been coming to the same hospital or the same doctor for many, many years, and all of a sudden they start seeing that things are being done differently, you may get some patient complaints. And that's part of the total quality management process, is that you start then looking at that as one of your outcomes and measuring how many complaints and what types of complaints and what can you do in a PDCA system to be able to improve upon that. Another of the pros is that there's very much leadership development when you change a culture and you change the management philosophy to lean thinking. But on the other hand, just like staff levels, you may have more management turnover. There may be people that just cannot handle, for whatever reason, this amount of change in their lives and in their career, so that you can have management turnover. And as I said, there's, in the past 10 or 12 years, there's probably been an increase in CEO and COO turnover at some of the institutions that are implementing some of these new theories. Another of the pros from an administrative perspective is that it is team-oriented. So there's an opportunity to get everyone involved in the process and able to participate in the culture change. But by doing that, as we saw, when you pull people off to be on TQM committees or Kaizen events or other process improvement activities, you do have to replace them in order to staff the department and continue to be able to provide patient care. One thing that doesn't happen is the hospital just doesn't close down because all of a sudden the board of directors wants to implement lean thinking. Hospitals are open 24/7, and it's an expensive endeavor as it is to staff 24/7. So when you then bring in this parallel activity, very much related to patient care, but not on the floors providing direct patient care, it can become very expensive. So this concludes the discussion for this evening or for this week, and it leads into what your assignment is for discussion board 2. And that you will find in the structure of the course, that there is a scenario that the health department has recommended Miriam Hospital after identifying a confluence of missteps that led a surgical team to operate on the wrong knee of a patient undergoing elective surgery last month. And the scenario is written up from the newspaper release of this surgical error. So the students in the class have already been assigned to one role, either the clinical role or an administrative role. That's also can be found in the discussion board assignment. And you will need to pitch your assigned perspective and offer support for this position as it relates to the process improvement for Miriam Hospital related to this surgical problem. So thank you very much. I hope this has helped you for this week, and I'll look forward to our next live session.